depression, either for men or for women. What exactly is happening to the mind?
It can be a very severe illness. Sometimes it can be so severe that one's perceptions of reality can change. They can become psychotic.
Dr. Ishrat Husain is a professor and the scientific head of the Clinical Trials Unit at the Centre for Addiction and Mental Health.
He also serves as the lead of the CAMH Mood Disorders Service.
What are things to look out for to go, oh, something is happening?
If you're getting to the point where you're having really dark thoughts, where you're feeling like you don't want to be around, then you need to go out and seek help.
I want to talk about the mood disorders, what you're seeing that can potentially help people self-regulate a little bit more.
Anybody who is experiencing some of these intense fluctuations in their emotions or in their mood, the development of healthy coping skills is really, really important. The first step comes with actually recognizing
Ishrat, welcome to Gents Talk.
Thanks for having me.
You and I met at Carol, shout out to Carol, who's just an incredible individual who just always seems to be connecting people together. But you and I met at a book launch event that Carol and yourself co-authored. It's called The Right Not to Remain Silent. Did I get the title right?
That's right.
Yeah, perfect. I'm proud of myself for that. And we started talking, and you made a very, very interesting observation to me from your line of work. And I'm going to jump to your bio in a moment just so that everybody understands, you know, what you do and your area of expertise. But you made a very interesting comment to me where you said, in the same, maybe not the same, but similarly to how women go through postpartum depression after giving birth, there is something that happens to men after the birth of their first child. And when you said that to me, I was kind of like, what? I couldn't even fathom what that could look like. I mean, I'd heard of dads talking about not feeling a connection to their child, and then feeling like, you know, like, I don't know who this being is type of thing. But before we go any further, I wrote down your bio because there's a lot of really interesting things and you do a lot of incredible work. So you're the scientific head of the Clinical Trials Unit at the Centre for Addiction and Mental Health, CAMH. You serve as the lead of the CAMH Mood Disorders Service, and you're an associate professor at the University of Toronto, where you also hold the Cameron Wilson Chair in Depression Studies and a Canada Research Chair in Treatment Innovation in Mood Disorders. Your research program focuses on advancing the understanding and treatment of mood disorders across populations through clinical trials of emerging treatments. That's a pretty lengthy bio.
Yeah.
I don't know how you do all that time. And you also look like a very young man. So, like, did you start when you were 12?
No, I did not. No, it's just healthy living, I think.
Okay. Well, you said that you had a workout this morning at Barry's.
It's really important.
How long was the workout?
50 minutes.
Okay.
Yeah.
How many calories burned?
I think probably 600.
Wow. I really got to try this Barry's.
Yeah,
I've heard good
great.
things.
It's a great workout.
I've heard really good things. I've heard people go in and then just come out and they're like, my ass just got kicked, but it was incredible.
Well, it's down the road from you. You should check it out on the way to work here one day.
Where?
On Richmond.
Oh, okay.
Yeah.
Oh, so close. I could do that right before and then come in a sweaty mess.
Yeah, exactly.
Okay, so I'm really excited to have this conversation. To jump back to the point I had made earlier, what exactly is it that's happening to men after the birth? Is it after the birth of their first child or after the birth of any child?
It could be after the birth of any child.
Okay.
So, look, you know, with the sort of transition into parenthood, whether it's a man or a woman, you've got lots of change in your identity, change in sort of who you see yourself as. You may be somebody who's, you know, very involved in their work or social life, but all of a sudden you've got changing and competing demands. And so everybody has to adjust to this change in role. The adjustment can really affect an individual in different ways. So there are some parents, whether that's, again, a mom or a dad, that can go on to develop a more severe form of an adjustment to that, change in role. So for women, you may have heard of the term postnatal depression or postpartum depression, and that's a very severe form of a reaction to that adjustment when they actually go on to develop a depressive illness in response to that changing role. Not necessarily just in response to that changing role, but then also you got to remember with women, they've been going through biological changes as well, hormonal changes, and that compounded with the change in role, the change in sleep cycle can lead to the onset of a depressive illness. But at the same time, we know now over years of research and study that actually men also can go through very severe reactions to that adjustment to the new role as a father. And that can be as severe as leading to a depressive illness in dads as well. And that's a condition called male postpartum depression. So it's understudied. You yourself, when we met, you hadn't even heard of it.
No, yeah.
And it's under-recognized, but actually it can affect up to 10% of fathers with their first child. And then it can also go and affect them with subsequent births of their next children as well. So it's under-recognized. I think generally you're aware with what you do on this platform that men's health and men's mental health in particular is I think an understudied and discussed subject matter. A lot of self-stigma that men hold towards what they can talk about and express, and I think that has led to this sort of neglect of this particular area when it comes to dads as well.
So maybe we can backtrack a second. Postpartum depression in general, either for men or for women, what exactly is it? How does it happen? What triggers it? You talked about the hormonal changes, the change of the role of suddenly becoming a parent. But what exactly is happening to the body or to the mind?
So we don't know necessarily what's happening biologically. There have been some sort of studies that have implicated changes in the neurochemicals in the brain that may be contributing to the onset of depression in that phase. It may be due to the hormone changes. For example, in women, they have massive shifts in the levels of estrogen and progesterone, which are the main female hormones. And it's thought that might be implicated as well. But to be honest, we don't know what the actual biological cause in our body is for the onset of depression, whether it's around childbirth or even in general.
I see. Okay.
So it's difficult to say exactly what's implicated. But how it presents is that, individuals following, the birth or around the birth of their child may be sort of feeling very down, very low in their mood, not as interested in the things that they would usually be interested in. Physically, they may not be able to eat. They may not have an appetite. They may not be sleeping. When they want to sleep, their child may need them, so they're unable to sleep. And then the most worrying and concerning thing for parents is that sort of lack of attachment to their child that can really present itself, which is very distressing for
I could only
parent.
imagine. I mean, I'm not a parent, but I've had friends talk to me about that.
Yeah.
And it sounds terrifying.
Yeah. And then, people with depression already have feelings of guilt.
Yeah.
And then that compounded by this sort of lack of attachment that they feel with their new child can even make that worse. So it can be, it can be a very severe illness. Sometimes it can be so severe that one's perceptions of reality can change. They can become psychotic and feel that, they may harm their child or do something to their child. And that's really worrying. So it's something that requires immediate attention and treatment.
What does treatment look like in something like that?
Generally with what we do in mental health and psychiatry is that we look at the severity of one's illness. So if somebody, is able to go about their functioning, they're able to serve in their role as mom, they're able to sort of look after themselves, we may use sort of less assertive approaches like talk therapies, Cognitive behavior therapy is a type of structured psychotherapy that's very effective and evidence-based for the treatment of depression. So that's something that could be used. If it's more moderate to severe and it's impacting one's functioning, impacting things like sleep, appetite, ability to look after themselves, then we may recommend some medication. So antidepressant medications are very effective for depression, whether it's in the postpartum phase or otherwise. So we would, use a medication that we know would be safe in women that may be breastfeeding as well. So that's generally the types of treatments that we would use.
So now I want to go back. At some point, I want to ask you, and if I forget, please remind me, but I want to ask you about how men can show up for their partners if they're going through postpartum depression, what they can do. I'm not asking you like, hey, what are the tricks of the trade for them to become their therapist, but more so how can they support them in these moments? Because I imagine if your partner, your closest person who, you just had a child with is suddenly going through this, you don't really know what to do. So I'm curious about what would happen in that scenario. But I want to go back a moment to when you talk about men going through their version, is there a difference in I imagine there would be to some degree a difference between between a woman's postpartum depression and a man's postpartum depression? Or are there similarities?
I think there's actually quite a lot of overlap.
Okay.
Depression can present in so many different ways, though, for any individual. Even two moms may have a very different presentation of how their depression can sort of manifest itself. But generally, there can be quite a lot of overlap. In men, we see less of that sort of severe end of the spectrum of postpartum depression where it can become that psychotic type picture. So,
how come?
We don't know, actually. That's
Okay.
a really good question and something to look into. But I would assume it's probably to do with some of the biological changes that men don't experience during the postpartum phase.
True. Yeah.
So some of those hormonal or neurochemical changes that men may not experience. Also, I think men aren't as in close contact with their child as the mother in the first couple of weeks following the birth. So I think when moms are so in contact with their child and they're having those feelings of guilt, that can really exacerbate very quickly. Whereas men are less involved, generally speaking, in the sort of early care of the child. So maybe that's contributing too. But overall, men present very similarly with depression, right? Lack of interest, lack of joy, lack of sort of feeling close to their partner or to their child. With men, it can also come out sometimes with irritability and outbursts of anger. We know that's how depression can present in men because they don't know how to sometimes express negative emotions in any other way. And that's kind of concerning because we do know that men with, a depressive illness can be more likely at times to engage in intimate partner violence. So that can be, a concern. And another reason why we need to recognize it, very quickly and try and address it.
That's a concerning bit of information there. Like that's a part of that process. I'm wondering as you were talking, I ask most of my guests, if not all of them, how we can better support men opening up, having these conversations. I have in front of me a gentleman who is trained in almost everything by the sounds of your biography. But you work for one of the greatest, most empowering mental health facilities. What would you say? What's your response to it?
I really do think that the way that we're going to reduce the stigma around mental health and the self-stigma, by the way, there's two concepts. There's like sort of the public stigma, and then there's the concept of self-stigma. That one who's experiencing issues with their mental health may have their own biases against themselves, right? I think the way that we're going to address that to improve the conversation is through education. That is the first and foremost thing. Like even like what you're doing is amazing. The platform like this, that lots of men are probably tuning into and hearing about, I think would allow them to open up, learn a little bit about what's going on with them, and then talk to people around them. I think that's the first step, educating individuals about, what are common, experiences for anybody. And then that education, I think, leads to a reduction in stigma. And I think we at our organization at CAMH have tried to do a really good job of around that messaging, trying to send out the message that mental health is health, in fact. It's not a separate entity altogether. It's just part of your overall health. And I think that's the way that we're going to be able to demystify some of the issues around it. As a researcher and scientist, I also do believe that doing research and sort of trying to unlock some of the mystery around mental illness by understanding the causes, the treatments, will then reduce the stigma. Because you over the last sort of 5 decades, not even that long ago, but even now in still some cultures, people feel that it's some sort of mystic or, spiritual thing that's happening to individuals, right? I do a lot of work in patriarchal societies. Like I'm originally from Pakistan. My family's from Pakistan, which is traditionally a patriarchal society. And we do a lot of research in that setting as well.
Interesting. What are you finding?
I've done a lot of work with men's mental health in that area because it's such a patriarchal society where sort of, the dad or the man is the main breadwinner. They don't go and talk about illness. They don't cry.
No emotions, no love, nothing. Yeah.
And so, but we found from our work there that the rates of depression are so much higher than here even. Like rates of depression in men, almost 42% of men in Pakistan in that population would experience a depressive illness. And so we've tried to do some work around that, some education around that. And the way that we've sort of intervened, so, we've framed our approaches to managing depression in those folks as a training program and not a therapy. Because I think the word in itself, therapy,
scares people off.
Exactly, comes with its own baggage. And when we have framed it as a training, it was, people liked that. They were able to engage in it. And we found that actually through that engagement, that education, really broke down barriers, improves people's mental health outcomes as well. So I think it is really about tailoring and personalizing our approach. We're living in Toronto, Western society, where it's becoming more acceptable to speak about mental health conditions. But I don't think that's applicable to all cultures, even in Toronto.
I agree with that.
Right?
Yeah.
If we go to Thorncliffe Park, I don't think everybody else would be talking about men's mental health the way you and I are.
Absolutely, yeah. If you go to, Celebration Square in Mississauga, same thing.
Yeah.
So I'm from Lebanon, and in my own community, I get criticized for having these conversations under the guise of that's weak Western ideology, right? Men don't show these things. You have to be strong. You can't show your woman anything. You can't show your kids anything. That's between you and God. That's this, that's that. And so when you talk about, 42% is such a massive number. Yeah. And it's not a small population either.
No. 250 million people.
Jeez.
Yeah. You could take Lebanon as a very sort of similar culture setting, right? Like they've got all of these psychosocial stressors, geopolitical issues, exposure to so many different stressors that the people in that population are exposed to. You can imagine why the rates of depression would be high. Now, sometimes I take the view of, how you described depression or mental health issues as a Western construct. I can take that from some folks in those settings. And And I think we have to frame it to them in a different way, right? Like the term depression perhaps is not the most culturally acceptable to them. I know, for example, people from South Asian cultures, when they're in mental distress, they will express it as a physical issue. Oh, like my head really, really hurts. But actually, there's something going on emotionally.
Yeah.
And that's okay as long as you sort of get to the bottom and get to sort of engage with them, to ask them about other aspects of their life, and frame it in a way to explain to them that sometimes when something's going on emotionally, it can present in physical ways as well. We do have to.
The physical. I'm laughing. Sorry about the like, oh, my head hurts.
Yeah.
It's because I've heard that before, and I think I've used that growing up. Like, oh, my head hurts, when I know that I was in a really bad spot, and I didn't know how else to articulate it. Because if I said something is wrong, like anyone around me would freak out. Like, what are you talking about? Something's wrong. Like, what does that mean?
Yeah.
So it's fascinating to me how we still struggle, and how there's so many men out there that just don't even have the ability to articulate the words. They don't have the tools. They don't even know what words to use.
Yeah. I think it's extremely common across cultures, across populations. I think others have more stigma than some Western ones, to be frank. But I do even think within Western populations, even if you take your general sort of white Canadian male, I don't think they'd feel as comfortable talking about their mental health issues to their peers as women might.
Yeah.
But I like I said, I think education is really important. I think shedding a light on some issues that are understudied, and as I mentioned to you, trying to explain to people that it's not a mystical, it's not this sort of mystery thing. There's actually something going on. Whether that's psychologically, emotionally, biologically, it's often a combination of all three. And I think that's what people need to understand with mental illness as well, or mental ill health, that it's not often just the chemical imbalance that's causing it. There's so many other factors. The human mind is the most complex organ in the body.
So how do you, you talked about talk therapy, you talked about cognitive therapy. Someone comes and sees another doctor. I think part of destigmatizing it is not knowing when you walk into a room with a therapist or a professional, what's going to happen to you. And maybe that's something that we can at least help by, it's like, this is what this looks like. This is what happens when you walk into CAMH and you see a professional. This is what the process looks like. So if I came to you and I said, you know what, my head hurts, and you can tell that I've either got some early signs of depression, or I'm really going through something, what are you doing with me?
So, the reason I got into psychiatry is because my whole job is about getting to know people and getting to hear people's stories.
Mm-hmm.
So what we do when you come to us for an assessment, or you come for an intake, or you're going out and seeking help, the first thing somebody's going to do is just listen to your story. We want to know who you are. We want to know, what's brought you to the point of the experience or the crisis, or what's going on with you. And I think listening to one's story or journey or experiences in life are really, really key, because it allows us to gain an understanding of what's going on with somebody in their sort of current emotional state at that time. We don't really do immediately, blood tests or brain scans and things like that to try and understand, because we don't have a reliable sort of biological investigation to tell us what's going on with somebody. We listen to people's stories. We hear you out. That's why you'll probably have a much longer appointment with a therapist or a psychiatrist than you would with a regular physician,
right?
Because we need the time to hear one story. And once we hear a narrative, we use, our experience and our training to sort of come to a provisional diagnosis of what's going on, and then we explain that to you. We try and give you some education around what you're going through, so you understand and empower yourself with the knowledge of what you're experiencing, because I think that's really important. Once somebody figures out, or can name the feelings that they're going through, people can then also try and take steps to address some of that, through changes in their own life. It doesn't always have to be that, a doctor gives you a diagnosis, writes you a prescription, and off you go.
Yeah.
And I think that's really important. That's at least our approach where I work, and what I do, and what I train my trainees to do in terms of the management of people with any sort of mental distress.
I want to go back to the postpartum piece. What are some early signs of it? If I have a really good friend who's about to become a father, and he's listening to this episode, he's watching this episode, and he's now thinking consciously about this, in X number of months' time, I could very well potentially find myself in this position, or his wife could be in this position. Knock on wood, nobody. But what are things to look out for in order to improve the self-awareness level to go, oh, something is happening, to try and catch it early on?
Yeah, so look, there's certain things that are going to be disrupted by the birth of a child, right? Like your sleep is going to be disrupted.
Yep.
And that's not always the first indicator to say, hey, something's going wrong, because everybody in the home is going to be on the schedule of what the baby needs at the current time. But I do think that it's really, firstly, as the male partner or the dad in the situation, you got to keep a close eye on mom, because they're still at higher risk of developing postpartum mental health issues. So it's really important to be there and be supportive, and keep an eye on their emotional state. It's totally normal for women in the first sort of 7 to 10 days following the birth of the baby to be more emotional, to be more tearful, to be more irritable. It's called the baby blues. Mm-hmm. So just keep an eye on that. But when it extends to beyond that, or if you find that your partner or mom is not eating, is not connecting with you or the baby, is more withdrawn, is not able to look after herself, those are warning signs that you need to get help for her. Try and get in loved ones, family members, to come in and provide support, and to also help the family unit really to try and get through. And if they are concerned and they're worried, then that's the time to seek professional help. Of course, at any time, if you're worried about somebody's safety, the baby's safety, mom's safety, she's saying things that she doesn't want to be around anymore, or things like that, that's really worrying, and means that you should get some emergency help. For your own sort of well-being, you got to look out for similar aspects, right? You got to make sure that you're able to look after yourself. You're still showering every day. You're eating meals every day. Like I said, the sleep piece, it's going to be impacted. But other aspects, you got to keep an eye out. If you find that you're getting irritable in the first first week or two, that's totally normal as well. You're not sleeping as well. You've got all of these changes going on. Yeah. That's fine. But if you're getting angry and you're not able to control those emotions, then there's an issue there. Yeah. And you may need to seek help. Speak to friends, loved ones about what you're going through. If you're getting to the point where you're having really sort of dark thoughts, where you're feeling like you don't want to be a dad, you don't want to be in this situation, you don't want to be around.
It's all overwhelming.
Then you need to go out and seek help. And seeking help doesn't mean necessarily, like I said to you, that it's going to be that somebody's going to pull out a prescription pad and write something up for you that you have to start and take for the rest of your life. I think it just sort of allows you to communicate what you're going through with a professional, and that might give you reassurance to be like, hey, you're okay. Keep going for a little bit longer. Come back to see us if things aren't going well in a couple of weeks. or if it is something serious, they'll be able to intervene sooner.
Yeah. Are antidepressants, there's a taboo around them, and I don't know enough about them, where I think there's a general worry where if you end up having to take antidepressants, it'll mess you up in other ways for a long time. Is there any truth to that?
So there's a lot of, there's been a lot of controversy around the use of antidepressants, the overuse of antidepressants, coming off antidepressants. It's been all over like mainstream media for the last couple of years.
You see it in movies and shows.
Yeah. And honestly, I think a lot of the stigma around the use of antidepressants is connected to overall stigma around mental health. I think, things weren't helped by, the sort of expansion of big pharma and the sort of assertive push of big pharma to prescribe antidepressants in the mid to late 90s. But really, what we do know over decades of research is that at least for individuals with moderate to severe depression, antidepressants are very effective. Like, 60% of people will get better with an antidepressant, So they can be game changers for individuals. And it doesn't mean that if you're on an antidepressant that you have to be on it for the rest of your life. For some individuals, perhaps, but that's only because their life is much worse when they're not on the antidepressant. Their depression comes back.
How do you? Well, I guess the question then is, if you were on antidepressants and you come off of it, isn't the antidepressant just a masking agent, essentially, just sort of putting a cover on you to say, all right, everything is fine, and then the minute it's gone, you're just like, whoa, no, not doing it. I need more.
No. So I think that for the way that we sort of, in rough estimates, about a third of people who start an antidepressants, they'll take it for, let's say, 6 to 12 months, and they won't ever need it again because they've recovered from their depression or anxiety and they move on with life. They'll use other types of treatments, whether that's talk therapy, whether it's like a healthy diet, exercise, and they'll be fine.
Yeah.
And then there's a third of people that they'll have recurrent episodes of depression when they stop their antidepressant. So those are the folks that need to be on it. And I don't think it's masking anything. I think it's actually treating an underlying pathology. Like, imagine somebody with diabetes, right? They're taking something to control their insulin and they need it for the rest of their life, because if they're not on it, that pathology of the sort of insulin metabolism will come back and their diabetes will be out of control.
Yeah.
So I think that for some individuals, depression can be a chronic illness that needs that sort of disease management approach of ongoing treatment.
This might be a stupid question, but if we don't know, to your point earlier, if we don't know enough about the human mind, we don't know what exactly is happening biologically speaking that'll trigger depression. Like, we're in the dark with so many things. How have we developed drugs to treat the thing that we don't really understand fully?
It's such a fantastic question. I think that when I say that we don't know exactly what causes depression, I think I mean for all individuals, because we have over the last sort of 3 or 4 decades, we have, through research, developed an understanding that in certain groups of people with depression, we know what's contributing. So we know that, for example, in some individuals, there's perhaps disruptions in neurochemical metabolism, particularly a chemical you may have heard of, often talked about, serotonin, which is like the happy chemical. We know that can sort of disruptions in the serotonin metabolism are implicated in depression for a group of individuals.
Yeah.
We know that in a group of individuals, changes in the stress hormones, like corticosteroids, can be implicated in depression. We know that in certain individuals, changes in inflammation in the body can be implicated in depression. And, these drugs that have sort of been developed, many of them, by the way, purely through serendipity, right? It wasn't exact science when developing a lot of these drugs.
Trying to cure one thing and figure it out, it cures another.
Well, exactly.
Yeah.
And that's how a lot of the antidepressants were discovered. So I think for some individuals in which, the antidepressants have certain effects. So we know, for example, antidepressants, although they, in a way, stabilize serotonin metabolism, but they also have lots of other effects. They act on other neurochemicals, not just serotonin. They actually have anti-inflammatory effects in some folks as well. So they're kind of multimodal in their action.
Yeah.
And I think that's why they go and help some people. Why they help some and don't help others is a really important question. And that's work that we're still trying to understand. It may be, for example, that they don't work in some individuals because the inflammation component is really high in those folks. And maybe adding in something that improves inflammation will improve their depression. And that's some of the work that I started my career looking at. And we're trying to move the needle on that. Is genetics contributing to sort of persistent depression in some folks?
Is it?
It may be, yeah. We're doing some work trying to look at genetic markers of treatment response. We're looking at like the gut microbiome and how that might be contributing to sort of, we know that the gut and the mind are closely connected as well.
Yeah.
And we're trying to figure out in some folks that don't get better or have persistent depression, is that contributing? So there's lots of areas.
There's
of
so
discovery.
much.
Yeah.
I have people in my life who have lived through war and seen the traumas of war, seen people get murdered, seen family members get murdered, seen the trauma of explosions and escape and going to new countries and figuring a language out and all those things. Good, kind human beings who've been kicked down by life, who are now older, and with just my own understanding of mental health, can see that there's a challenge there, a blockade. Pretty much can probably tell that these individuals suffer from some form of depression.
Yeah.
But there's a resistance to doing anything about it. How can we actually support our friends, our family members who've gone through something traumatic like that? When you can see it, it's not part of their vocabulary. They won't. If you were ever to hint, hey, you should talk to someone. No. What could I do? What can people do when they know someone going through something like that?
I'll come to answer that in a second, but I do want to touch on the really important point you raised here, which we haven't discussed yet, which is the role of trauma and adversity in life, and how that can contribute to mental health issues, particularly depression. So we know that early life experience, early life adversity, childhood trauma, unfortunately is associated with lots of adverse health outcomes, whether that's physical or mental. But we also know that it's also associated with more resistant or chronic depression. And even trauma in early adulthood is associated with mental health issues. And you may have heard of the term PTSD, post-traumatic stress disorder. There's also a term called complex PTSD, which is sort of folks that have been through repeated and severe traumas in their life and exposed to that, and how that can present with mental health issues, which can be very challenging to treat. We know that trauma is associated with depression. So, like those in your circle that you just alluded to that may be going through something, they may be experiencing mental health issues. And I guess the question is that do we approach them because we can see that it's impacting their functioning and it's causing distress, or are they able to go on and live a personally satisfying life? Because I have people in my circle of a certain generation who have been through traumatic experiences, but they go on, they live life, they function, and when I have tried to sort of touch on some of the things that they've experienced, they said that they don't need to talk about it. They're absolutely fine, and they're getting what they need out of life. And I think in those situations, it's really hard to push somebody out of their shell and get them to seek help, because as far as they're concerned, they're living the life that they think is giving them satisfaction, right? There are some individuals who go through those traumatic experiences, by the way, who do not get the satisfaction that they need out of life. They cannot function. And those are the individuals that I think that, we should, try and approach and ask them for. I think it becomes very, them, I think it's very challenging, though. I'm sure everybody that you've met who's been through trauma, not everybody has a mental health issue.
Correct, yeah.
Right?
Yeah.
There's some folks that are, for some reason, which
fully
we don't understand, are way more resilient.
Yeah.
And that is the fascinating thing.
Resilience is a great word.
Yeah, the resilience piece is something that I really would like to spend some time in my sort of career over the next little while trying to explore. Why are some folks more resilient than others in the face of adversity? Maybe we should be trying to look at those individuals and try and understand what it is from their experience, their background, their biology that leads to that. And why are there some that don't? We don't know.
Can you replicate that somehow as a treatment for others?
Well, exactly.
Yeah. The resilience piece, I think, is absolutely fascinating. I'd love to see that get fleshed out more, because, I like to think of myself as a resilient guy because of whatever has happened in my life that I've looked at and could have easily said, all right, hang in my hat, this happened to me, woe is me, I'm done. And instead, I took that and said, okay, how do I actually learn from that, grow through the pain, and then become a better version of myself? And I've had conversations, to your point, with others who are, to this day, something could have happened 10 years ago, have never been able to let go of it, move on from it, learn from it, grow through it, type of thing. So I'm very fascinated about the concept of resilience and what and how it works for some people and not others.
So for those individuals that I think that you mentioned there that are holding on to something and not able to let go, and it's still impacting them now, I think those are the folks that need a lot of work that we should, what they need is, honestly, they need attentive, trusting psychological support to help them process that adverse experience, to build resilience through that psychological support and then move forward with their life. They may never forget that experience, but they can sort of develop skills to sort of allow them to move forward with the knowledge that, yes, that was a really terrible, life-changing experience, but I'm not going to let it impact the rest of my life. Yeah. And I do think that psychological support, that's what it needs. It's like with somebody that they trust, they can develop a relationship, an alliance with, seeing that individual to work through that in a trauma sort of informed way.
Yeah. And it's a group effort.
Yeah.
And I think that's the other piece too, is sometimes we try to, in our friends circle, our families will say, hey, you should go talk to someone, but not want to actually be there to say, hey, if you wanted to talk to me, I'm obviously not a professional and I can't really support you the way a professional can, but I'm also willing to just sit here with you and listen if you want to vent or just get something off your chest, where you can feel like I'm a safe space for you, type of thing. And I think there's a need to remind people that you can still support your friends, your families, your loved ones by just being there.
Absolutely. Yeah. I mean, look, I am a professional in this area, but I'm also a friend to people. I have a lot of sort of male friends that I grew up with, went to high school with, and, some of them are professionals in the sort of related areas, but they still feel uncomfortable within our group speaking about what they're going through. But like individually with me, they can talk about some of the things. And I speak to them as a friend, not as a professional. I speak to them sort of to just sort of have that, give them the space to be able to talk about what they're experiencing. And of course, when there are times when I feel that they need that professional help, I'll guide them to it. And that's what we can all do for each other.
I want to talk about the mood disorders.
Yeah.
So, my partner Mila will often say that when I'm stressed out, I get very moody. I could be, the highs can be high, the lows can be lows. And the self beating can essentially make me very sort of like, I can get into this state where I'm just like focused on nothing but the negatives, and that changes my entire mood, and it shifts how I think about things, how I see things, my reactions to my puppy, all those things. Not severely, but enough that it's noticeable, and I notice it too. And so I'm constantly trying to self-regulate, be more self-aware of what's happening that triggers this. Did I wake up this morning and have see a really frustrating email, and haven't even gotten to the gym yet, so I haven't had the ability to like really get the blood flowing or anything like that. I'm curious, from your line of work in mood disorders, what you're seeing in this space that can potentially help people self-regulate a little bit more, because it seems like these days a lot of people are just very moody, and it's easy to just be like, that's a very moody person, without understanding what's happening there.
Firstly, you need to stop checking your emails before you go to the gym.
I know.
That's the first thing.
I know.
It's like, go to the gym first.
Yeah.
But yeah, no, I think that you really spoke quite eloquently about a good way to be able to regulate, manage, monitor your mood. I think that it's not an easy thing, though. It's not something that comes naturally to most people. Most people, including myself, we you go on with life. You don't think about sometimes what's going on with yourself internally all the time, because life is just so busy.
Yeah.
And you don't take the moments to sort of check in with yourself to see what's going on with you internally or mood-wise. I deal with the sort of severe end of the spectrum of mood issues. So I will see people with what are disorders, where the mood changes are so severe that it impacts one's ability to sustain an occupation or relationships. Things like bipolar disorder or major depressive disorder. So those individuals, the advice I give would be very different from somebody who has, daily fluctuations in their mood, which is within the normal sort of range of human emotions, which we all go through. And I think that it's important not to pathologize all the time.
I agree.
I think it's like really important that people know that you're allowed to experience irritability once in a while.
Sometimes you just got to feel it.
Yeah, you got to feel frustrated. It's okay if you got a crappy email. You're allowed to feel frustrated with that. Now, how you express that frustration is important.
That's the key part.
Right? How you cope with negative feelings and emotions is a key part. If you're taking it out on your puppy or your girlfriend, that's not.
Which I don't.
Yeah. But that's
it's one of those, like, I notice it and I go, I'm feeling like very irritated right now. And
how do you manage it though? What do you do with it?
I struggle sometimes. If it's so, I'll use this morning. Actually, it's a perfect example. That email. Yeah. I woke up this morning, 5 a.m. Went to turn off my alarm, and again, that's on me. I should get an actual old school alarm.
Yeah.
But as I turned off the alarm, I saw an email that I'd been waiting for, and I looked at it, and it was not what I had wanted to see. And immediately my mind started racing. I started thinking about all the different impacts that this email now has, right? This bit of information now means I have to do A, B, and C. It also means, D and E and F can't happen anymore, and they're delayed, and all of these different things. And I'm running through all these scenarios, and now I'm just angry, right? I've worked myself up to anger at this point, and I know I'm doing it to myself, but it's just my mind has run wild with this one single email. By the time I got up and said, okay, you know what? I need to get to the gym. I went to the gym, and it was probably the first time I've gone to a gym where I hadn't have headphones on, because I was so in my head that I didn't even need I didn't need to watch a show, listen to music, a podcast, nothing. I was just thinking about it, and I found myself doing like 45 minutes on an elliptical just thinking about this thing, not realizing the time. Funny though, the blood flow, the exercise actually allowed me to just sort of calm down a little bit.
Yeah.
So exercise for me is a big part of it.
Yeah.
And by the time I got back to the house and showered and all these things, I was like, okay, I'm starting to calm down. But I made it intentional to not immediately just like, I'm not going to the gym. I got to go solve this now. It's like, hold on, take a breath, go do what you know works, have whatever that is for you. For me, it's going to the gym and then dealing with it. So here I am now a handful of hours later. It's still in my mind. Nothing has really technically been resolved yet. And I know that logically, but emotionally, I feel a little better.
Yeah. So you just gave a great example of what's called an adaptive or healthy coping mechanism, right? Exercise in your situation. So for anybody who is experiencing some of these, I think, intense fluctuations in their emotions or in their mood, the development of healthy coping skills is really, really important. Mm-hmm. And I think that can include anything from distraction to with something healthy. And don't go and distract yourself and, pick up a joint and start smoking that. That's not necessarily going to improve outcomes. But if you, go for a walk, go talk to a friend, go do some exercise, even, honestly, even like putting on something on TV, if you feel that works for you and distracts you and helps you get through a stressful moment and prevents you from making out an irritable outburst on somebody who's near or could have like negative consequences, then that's what you should do. Yeah. And I think that, the first step comes with actually recognizing what's going on with yourself internally. That comes with a lot of work for people that aren't used to it. It gets down to the basics of when we actually do the sort of treatment around it. We actually get people to sit down and do what's called like a thought and mood diary, where they have to sit down with a pen and pencil and paper and write down what they're going through. It can seem really prescriptive and really, really annoying, but for folks that aren't used to identifying what's going on with them internally, it's a really, really helpful tool.
That's why there's a rise in journaling these days.
Yeah.
It works. It's just getting that, but it's like the physical act of just writing, because when you can't write as fast as you can think, you might be able to type close enough, but you can't write, and so it slows everything down for you.
Yeah. And honestly, for some people, it can be really tedious when they first start it. But for those that, aren't used to it or aren't used to sort of recognizing what's going on with them internally, it's really important. For anybody who's, by the way, going through any difficulties in mood, one of the best books that I would recommend, which is kind of like a workbook that we have based cognitive behavior therapy on for the management of mood, is something called Mind Over Mood. It's available on Amazon, most outlets. It's like $20, and it's like a really easy to read workbook on managing these emotions like mood, anxiety, fear, things like that.
Oh, very cool. Like it's a workbook, as in like you're actually interacting with you.
So it's kind of like guided self-work.
Yeah.
And it's something that I sort of tell everybody as a life skill.
Yeah.
Not necessarily as a treatment, but just as a life skill. Really useful.
What are you most scared about in the space that you're working in right now? What you're seeing, whether it's a rise in something or something that just has gone untreated for too long that you're seeing worrying trends with? Is there something that stands out to you as, hey, we need to be really concerned and we should really focus in on this?
So which we haven't touched on, one of the areas that I work on is sort of the potential role of psychedelic therapies, like psilocybin therapy and its potential. And what I'm concerned about in that particular space, I'm concerned of a lot of things, but like the main
we'll
thing,
have an episode of just things you're concerned about.
The main thing I'm concerned about is particularly where we are in Toronto, the sort of proliferation of these, cannabis dispensaries, cannabis stores, and also these now mushroom dispensaries, and these agents being already sort of bandied about as this sort of self-help treatment that we should all be doing.
Yeah.
And I'm very concerned about that because I think our young people, those under the age of 28, their neural connections are still developing. And I think that by increasing access to these, to be quite frank, psychoactive, mind-altering substances in early life is not a good outlook for our youth.
Interesting.
And I know that most mental health issues, 80% of mental health problems, start before the age of 18.
Yeah.
And if our young people are having easier access to things that can alter their minds, then I think that that's problematic. I think that's hugely problematic. I'm also really, really concerned about the fact that, you know, more of our young people are going through like traumatic experiences. They're going through a lot of stuff online. And I think that there is this sort of epidemic of mental health issues in the youth population worldwide. And I think our mental health services, I think our society is not equipped to deal with a lot of that. And I think that we got to make sure that young people are aware of what's going on with their internal space as well. Like we've talked about men and other people being aware of what's going on internally. But I do think that it really should form part of our school curriculum. And I think it is in some schools and in some...
But just not enough.
Not enough. Like kids should be able to speak about what they're going through emotionally and name their emotions.
That's you just touched on like two big topics that I'm like, man, I want to have another. We're definitely going to do a part 2 to this. And I never want to end an episode on a sour note. So not that there was sour, like I want to try and give something uplifting. What are you seeing happening positively in this space?
You know, what we started with, which is I'm so pleased about the progress that we have made over the last even decade on the conversations around mental well-being and how crucial it is to not only an individual's sort of success, but society's success. And I think that we've come a long way in that time. I think in whether that's in even a place like Toronto, but I do think even worldwide the conversations are improving. And I'm hopeful actually that over the next 10 years this is going to continue. We've seen more funding for mental health treatments. We've seen more funding for mental health research. And I'm hoping that trend continues because I think that's going to lead to the demystification. I think that's going to reduce stigma. I think that's going to allow people to go out and get help. And I think platforms like this, like what you're doing, Samir, I think this is fantastic. I think this is something like this wouldn't have been around 10 years ago.
Thank you for saying that. That's ultimately the goal here, is how do we normalize these conversations and destigmatize this idea that men don't suffer from mental illnesses. And truthfully, everyone. I mean, there are, equal parts women who are also just, I'm good, I'm fine, but are equally struggling. And I think that's what's made this series resonate with so many people across a wide spectrum of society, right? Of how do you pull the curtain back on this and go, hey, it's okay to not be okay.
Yeah.
But now you got to do something about it, right?
Yeah.
Obviously, it's okay to say, I'm not feeling the best version of myself today, tomorrow. It's been a week, it's been a month. But now which is why I always ask for practical advice. Like, how can you actually either be the support or go seek the support? Because then maybe that helps destigmatize it. And if one person goes and does that, success.
Exactly.
Right? So, Ishrat, thank you so much.
Thanks for having me.
This was fantastic.
It was
I want to do this again if you're up for it. I think I'd love to pull on that thread of the psychedelics piece. I've had on a few guests talk about it who one has talked about it from the sense of like it's completely changed his life around.
Interesting.
And then I've had on another guest talk about it from the lens of how it's being used for therapeutic purposes when it's, like psychedelic assisted therapy, I think it was called. But I'm fascinated by this idea of, under the age of 28, certain things have not developed yet and what can potentially happen. And you're right. I mean, with the ability to access all of these things, you kind of want to make sure that it's being done the right way.
Exactly.
And the third item that I'd want to pull on is drugs, alcohol, just understanding the real effects of those on you. How much can you have? How much should you have? When should you consider not having it if, you're noticing certain things happening? So all that to say, I think a part 2 is definitely going to be needed. And I thank you so much for your time. You do amazing work. Please keep it up. And we'll be in touch soon to chat about part 2.
Sounds great.
Thank you so much, everybody.
Thanks. Take care. Bye.